It's about 1:03 now, and it appears that we do have a quorum. So Chair Fletcher, if you want, Chairs Fletcher and Dorsey, if you guys want to kick the meeting off, we're ready to start.
Okay. Good afternoon, everyone. Thank you for being here and attending our November Department of Human Services Division and Family and Children's Services Advisory Board joint meeting. We will have greetings from Chair Bever, Dorsey Mart, and then we will call for DHS board attendance.
Chair Belva is working on logging on right now. So if you want to go ahead and do the DHS attendance, she'll make some remarks afterwards.
We'll do that. We will now have the DHS board attendance.
Okay, so I am calling from the login, and of course, we've got you present, Chair Fletcher. Mr. Dave Barbie is on, Mr. Randy Smith, Miss Monica Walters, Mr. Jack Williams is present, Mr. Scott Johnson, Mr. Rochard White, and Mr. Randall Smith. And I believe that Mr. Wesley was planning to join us. He may not have gotten in yet, but it appears that we do have a quorum.
Thank you,
Jackie. This is Wes. If you can hear me, I'm on.
Okay, you must have dialed in. I just noticed a couple of external numbers. All right, wonderful. We've got you accounted for then.
Very good. So we have 100%. Am I correct?
Yes.
Hey.
Well, and I see Miss Lisa Hamilton. I don't believe I mentioned her name, but she is present as well.
Okay. We have 100% of all of our board members present. So that is a good thing. Very good. Is Chair Bevel Dorsey Mart, is she on yet?
Chair Dorsey? Let me check on that.
Let me know when she signs on and we will go back and let her do her attendance.
Good afternoon.
Oh, she's on. Okay.
Wonderful. She may be having some technical difficulties, but I do think I heard her just as you did, Chair Fletcher.
Yes, I think I did. Okay.
Yes. Good afternoon. This is Belva Dorsey Mott. And unfortunately, I'm not able to log into Teams, so I'm having to call in on the phone.
Okay. So what we're asking for you to do is to call for your attendance.
Yes, ma'am. Thank you so much, Chair Fletcher. So I will call, I'll do the attendance for the DFCS Advisory Board meeting or board members. Do we have a representative from Region 2? Region 3, and I'm not sure if everybody's muted and if they're having to, make a note in the chat or not. Region 5. Region 6.
Yes, Nancy White for Region 6.
Thank you. Region 9. Region 10. Region 11.
Lacey Tippins, Region 11.
Thank you. Region 12.
Allie Christensen, Region 12.
Thank you. Region 13. Region 14. And then with our at-large members, Janice Van Ness, Jennifer Shinpolk,
Good afternoon. This is Jennifer Shinpo.
thank you. And then we have a new member, at-large member, Jeff Meyer. Emma, are you able to
Yes.
indicate whether or not we have a quorum?
We have representatives from Region 3, Region 6, Region 8, Region 11, Region 12, and 14, and then one at-large member, but we are not at a quorum. We can take attendance again before we vote on any items.
Okay, thank you. And do you know if there are other members who are having a difficult time accessing the link?
I think at this time we have everybody logged on, but I do know we have 2 members that are joining us late today. So we should have a quorum later in the meeting.
Okay, thank you. So at this time, we're unable to secure approval of the meeting agenda. Do any of the members who are present have any questions about the agenda, or are there any corrections needed? Okay, if not, then Chair Fletcher, I will turn the meeting back over to you. Thank you.
Okay, thank you. And if you want to come back to that motion so that it will be on the record, we will do it after the reports. If you
Okay.
can secure a quorum.
Okay, thank you.
Okay, thank you. We will now move on to our program reports. Our first report for today is the Aging Services Update by Ms. Mary Lee Boatwright Quinn.
Good afternoon, Chair Fletcher, Chair Dorsey, Commissioner Brose, and members of the board. I am Mary Lee Boatwright Quinn, the Assistant Deputy Commissioner of the Division of Aging Services. And today I'm going to highlight a few data points for you and also tell you about the efforts we are making to assess and improve how we are addressing social isolation and loneliness within our aging network. Our vision at the Division of Aging Services aligns with the goals of the Older Americans Act. We are working to create communities where all can live long, live safe, and live well. Next slide, please. I am excited to share about one of our management team members, Anna Thomas, who leads our Forensic Special Initiatives Unit. Anna was recently sworn in by Governor Kemp to serve on the board of the Georgia Commission on Family Violence to represent the needs and voices of at-risk adults. Congratulations, Anna. Next slide, please. I did want to tell you some great news. The Division of Aging Services held its annual Light Up the Holidays gift drive, and thank you to all of you who participated and helped us fulfill the wishes of 446 Georgians who are persons under guardianship with DHS. We are thrilled to have had so much participation from our partners and stakeholders, and now the fun part begins, delivering the joy to all the recipients of those wish lists, and our public guardianship case managers get to have the fun of delivering those gifts. Next slide, please. So speaking of our public guardianship clients, I did want to share that as of November 14th of this calendar year, we have increased to over 1,400 people under guardianship. Our numbers are steadily increasing, as are the caseloads of our public guardianship case managers. Next slide, please. In addition, as you probably can imagine, the number of reports to our Division of Aging Services, Adult Protective Services, also rises each year. And as of about mid-November, our total number of reports for this fiscal year was 17,457, which means that we are on track to once again increase year over year on reports of abuse, neglect, and exploitation of older adults. We've had so many success stories as of late that I couldn't pick just one to share with you. However, I just wanted to thank all of our Adult Protective Services investigators who walk into situations each day not knowing what they are going to find, but they put the vulnerable adults first and work tirelessly to ensure their safety and get them much needed resources. We are so grateful that they are willing and able to do this very difficult work. Next slide, please. So as I mentioned, today I have decided to highlight for you the issues of social isolation and loneliness experienced by our older population. This is a topic that you probably have now heard of because it did rise to the forefront during the COVID pandemic. And we had some dedicated American Rescue Plan Act dollars to address social isolation. We ended up hiring 2 staff to evaluate our aging network's effectiveness in addressing social isolation and loneliness. And Brenda Lynn and Yulisa Hernandez have been a tremendous asset to our team. I wish they could have been here to tell you all about this important topic because they are experts in it now, but they have entrusted me to present their slides to you. As an initial step in DAS's efforts to respond to social isolation threats amongst our population, we contracted with the Georgia Health Policy Center to identify existing empirically supported measurement tools for integration into DAS's current assessment process. The Georgia State University Health Policy Center completed an assessment search for self-administered validated social isolation and loneliness screening tools to facilitate the adoption of services, meet increases in demand, and respond to a host of other challenges brought on by the COVID-19 crisis, but that continue today. Next slide, please. I'd like to draw your attention to this pressing matter that affects not just the emotional well-being of individuals, but their overall health. The evidence is compelling, as social isolation and loneliness have been shown to pose a greater health danger than some of the most commonly acknowledged threats. According to various sources, including AARP, social isolation and loneliness surpasses the impact of cancer, cardiac disease, depression and anxiety, and substance abuse. To put this in perspective, the National Institute for Healthcare Management asserts that the physical impact of social isolation is equivalent to smoking 15 cigarettes a day. It's a stark reminder of the tangible health consequences linked to the absence of social connection. Furthermore, the implications extend beyond the immediate physical toll. Studies have shown that social isolation is associated with a 50% increased risk of dementia, and poor relationships are linked to a 29% increase of risk of heart disease. These findings emphasize the wide-ranging impact of loneliness on mental health and physical health. And there's a financial dimension to consider as well. The costs associated with social isolation are estimated at $6.5 billion a year of Medicare funds due to increased hospital stays because community support at home is lacking. The evidence is clear. Social isolation and loneliness are not only a significant threat to emotional well-being, but also a substantial risk to physical health with broad-reaching consequences. Addressing these issues are not just a matter of compassion, it's a strategic imperative for individual and societal well-being. Next slide, please. So in response to the challenges posed by COVID, the CARES Act enabled DAS to proactively adapt its services, address heightened demands, and confront various crisis-induced issues like social isolation. As I mentioned earlier, DAS partnered with the Georgia Health Policy Center to identify some tools for integrating into our current assessment processes. So on the screen, you see here the two tools that we have chosen and that we are integrating now into our assessment. Those are the Lubin Social Network Scale for social isolation and the UCLA Loneliness Scale. We are currently working on consolidating both assessments into a single user-friendly interface. And this integration aims to enhance the data that we're collecting, and so that we can enable a more comprehensive approach to addressing social isolation and loneliness amongst the population that we serve. This initiative underscores our commitment to understand and address the social well-being of older adults and to promote a more holistic approach to address their health and social needs. Next slide, please. So as part of this work, we took a little bit of a deeper dive into some of our data that would help us understand some of the areas in the state that maybe we needed to address this with greater focus. So as you can see here, we found that in 2023, 43% of the clients we serve with home and community-based services were living alone, which means, of course, that they are at risk for social isolation and loneliness. As we transitioned into state fiscal year 24, this trend has slightly increased, and as of year to date, 44% of our clients are living alone. To further emphasize the prevalence of social isolation among older Georgians, Connect to Effects map, which was developed by the National Opinion Research Center, or NORC, at the University of Chicago, which you see on the right here, reveals that a significant percentage of individuals aged 60 and above living alone are at high risk for social isolation. This data underscores that social isolation is a prevalent and pertinent issue. As we move forward, we remain vigilant in our efforts to enhance the well-being of these individuals and continue working collectively to mitigate the challenges associated with social isolation and loneliness. And on this next slide, you will see basically the tiered approach that our two staff have taken to address this within our aging network. They included creating a visualization of our workflow across the network so that we would know how we were assessing and currently addressing social isolation and loneliness. Next, we move into strategizing, as well as training and raising awareness across our network of this issue. And then we're also engaging our partners across the network. It's really important that we engage with our community partners who can help reduce social isolation amongst those that we serve. Next slide, please. I did want to share just a few examples when we were doing our assessment across the network of some of the unique programs that our area agencies on aging already have in place to address social isolation and loneliness. At the Atlanta Regional Commission, they have the Community Connect program. This initiative focuses on addressing loneliness through in-person engagement in a group setting where participants collaborate on a variety of activities. They also have a telephone reassurance program that relies on the contribution of volunteers. In the coastal area, they have the Call to Care program, which is a senior companion program outsourced through a contract with GSU and a community agency. And this telephone reassurance program actually connects younger folks with our older adults. So it's an intergenerational approach. In the southwestern part of the state, in Sewega, our AAA there has used Claris tablets for engaging folks who are experiencing isolation and loneliness through, it's kind of a tablet device, and they can engage with other participants through that Claris tablet. There are several others on here, but another one I wanted to highlight were the Northeast Georgia Area Agency on Aging, and they have a comprehensive supportive caregiver program that pairs caregivers with other clients and caregivers in wellness programs to help address their isolation that they experience as a caregiver. So these are just some of the great programs that we already have existing that we're also trying to take best practices from and expand across the entire state. Last slide, please. I just wanted to summarize by sharing some of the impactful strides that our new staff has achieved already. As I mentioned, we've developed this visual workflow, and we were able to identify service gaps and collaboratively work with our team members on a solution to streamline our process and entry point to these programs. In addition, the partnership across divisions with community partners, we were able to create a work group that is ongoing to continue to address these issues. As well, we have also integrated our evidence-based programs, and we're identifying some of those programs to be able to address folks who are impacted by social isolation. And all of these things we are continuing to put in place, and even though our 2 new social isolation staff are only funded through September of 2024, we hope to ensure that we have ongoing systemic change that will help us address loneliness and social isolation across our entire network, even after those funded positions are no longer with our department. And that is all I have for you all today. Thanks for letting me share about an important issue that our older adults face. And welcome to take any questions or address anything in the chat if anybody has anything.
Thank you very much for that report. Very informative. Board members or anybody else, anyone that's in attendance, do you have any questions for her at this time? Hearing none, just thank you so much. We'll move on to our next report, which will be Child Support Services update by Mr. Christopher Ayers.
Good afternoon, everybody. Madam Chair, board members, and Commissioner Brose. My name is Christopher Ayers, and I serve as an Assistant Deputy Director of Field Operations for the Division of Child Support Services. And I'm excited to be with you this afternoon. It's my honor to be able to present our division's federal fiscal year 2023 performance outcomes. On our next slide, we have our, back up one. There we go. One more. I think back up a couple more then. We got going too fast there. Okay, right there's fine. So this is the introductory slide to our year-end performance outcomes. And on our next slide, you'll see these are 4 of our key performance outcomes that we track: current support, arrears, support orders, and paternity. For current support for federal fiscal year 2023, the total number of current support due, we collected 60.04%. For arrears for federal fiscal year 2023, the total number of cases with arrears due, we collected a payment on 66.41% of those cases. For support orders, the total number of cases in federal fiscal year 2023, and the order was established on 89.54% of those cases. And for paternity, the total number of children born to unmarried parents in federal fiscal year 2022, and paternity was established or acknowledged on 92.20% for those cases. And as you know, the federal benchmark for paternity for us is 90%. And once again, we're glad to say for federal fiscal year 2023, we were able to meet that benchmark and exceed that benchmark. These numbers here are not just numbers and percentages to us. They represent families. They represent parents who owe support, parents who receive support, and probably most importantly, the children who the support is intended for. So we want to take, in the next few slides, we want to take a closer look at how these impact the human aspect of it. We're beginning with the next slide, current support. So here you can see the 312,560 active cases we had in federal fiscal year 2023. That represented 428,631 children who received services. As you can see, we collected almost $500 million in federal fiscal year 2023 and distributed that to the parents receiving support to take care of the children involved. Oftentimes, the custodial parents or the parents receiving support, they rely on this income to help with rent, buy food, clothes, daycare, things that their children need. On our next slide, we'll take a closer look at the arrears. You back up one. Okay, there we go. So here you see we had 173,204 cases paying towards arrears, and we collected over $172 million in arrears payments and distributed that for federal fiscal year 2023. So we had combined collections for current support and arrears totaling $670,330,718 in federal fiscal year 2023. Also, recently, in October, we had a very large arrears collection by our Albany Intergovernmental Hub, totaling $148,746.79 on one case, and that paid that case in full. And when we celebrate these and we send them out through email when we have a large collection, and I often think it's kind of like the parent receiving support, like winning the lottery. I mean, if you think just one collection totaling over $148,000, that's like definitely Christmas come early for that family. So next slide, we'll take a closer look at support orders. As you can see here, we had, I'm sorry. Yeah, there we go. So 279,875 cases with a support order, over 11,000 families that received services to establish an order in federal fiscal year 2023. Out of the 156,215 families with healthcare ordered, healthcare was provided to 124,880 families, or about 80%. On our next slide, we'll look at paternity a little closer. So here we had a little over 57,000 children who were born to unmarried parents in federal fiscal year 2022. And then in federal fiscal year 2023, paternity was established for 52,618 of those children. And then DCSS initiated over 9,000 genetic test referrals in federal fiscal year 2023. So now we'll move on to a few highlights for the division for federal fiscal year 2023. Now on the next slide, you'll see where the Georgia DCSS, we hosted the 60th Eastern Regional Interstate Child Support Association, or we call it ARICSA for short, the conference in Savannah of May of this year. There were over 550 attendees, and Georgia DCSS provided 35 volunteers to help with the conference. And it was a great success, and everybody had a great time. And on the slide there, you can see some familiar faces. Next slide, we'll take a look at some individual highlights for some of our staff members who received recognition during federal fiscal year 2023. Top left, you see Elizabeth Liz Schreiber, and she received the 2023 INSEA Emerging Leaders Award. Liz is our strategic performance planning manager, and she's one of the leads for our system modernization project. Top right is Mary Stewart. She received the ARICSA Award for Professional Excellence for a frontline child support professional. Mary is an Agent 3 with our Winder local office. Bottom left is Monica Hall. She was appointed to the ARICSA Board of Directors for a 2-year term this year. And Monica serves as our Director for Training and Professional Development. Angie Hill received the ARICSA Gordon Mosley Rising Star Scholarship to attend the ARICSA conference, and Angie was recently promoted to a supervisor in our East Point office. On our next slide, we'll take a look at a grant that we have received. DCSS was awarded a 5-year SAVES grant, and SAVES stands for Safe Access for Victims Economic Security Demonstration Grant to implement comprehensive domestic violence services to survivors who need assistance accessing child support. And one thing we've been doing as part of this grant, we've been receiving training from the Federal Office of Child Support Services on gaps that maybe we have currently to service this group of customers who are victims of domestic violence. So in September of 2022, the Federal Office of Child Support Services awarded Georgia DCSS an original grant amount of $313,873. And then on the screen here, you can see we have received 2 more supplemental awards. Total for the first so far that we've received for this grant is $909,373. On our next slide, as you can see, I think we can go back one. We might have missed one. Okay, go ahead to the next one then. All right. So DHS is undertaking an initiative to modernize the DCSS support tracking, accounting, and reporting system, or we call it STARS. DCSS completed a feasibility study which provided detailed technical, operational, and financial information necessary to evaluate and justify system modernization. The Federal Office of Child Support Services approved our feasibility study on January 31st of 2023. This project will result in a full replacement of the front-end case management system for users and back-end database, batch systems, and servers. The division would retain and reuse some existing components such as the DCSS on-the-go mobile app and document imaging system. We are currently in our readiness activities phase. As you can see, this big purple arrow pointing to it. During this phase, we'll be working on certain work stream activities such as business process re-engineering, organizational change management, procurement efforts, and resource and governance planning. The goal of these activities is to ensure that we're prepared as we move into the next phase of the project, which will be the design, development, and implementation, or DDI phase. Next slide. Thank you very much for your time and attention today. My contact information is listed here, and I'll be glad to take any questions you have at this time.
Well, thank you very much for that informative report. I have a question. You gave us one federal benchmark that we exceeded. Are there other benchmarks that I know we hear the numbers, but where are we with the other federal benchmarks? Did we fail to meet them, or we met some others?
Our other federal benchmarks, let me go back to the slide. If you want to go back to that slide, keep going back so we'll know what we're looking at here. Keep going back. Just a little bit more, a couple more. One more. Okay, so right here. So the paternity benchmark is the only one that carries a financial penalty.
Penalty, okay.
Right, if we don't meet that, and that's why we highlighted that. Our other key performance outcomes here, support orders, they are a graduated system. They do have, it starts like for support orders is 80%. If we reach 80%,
Okay.
then we are due to receive 100% of our possible funding that we can get, incentive funding from the federal government. Current support and arrears. Current support is 80% also to receive 100% of incentive funding. So we're a little bit lower on that. And that's something we always continue to strive to increase and improve on. We did finish just a little bit higher this year than we did last federal fiscal year in current support. And arrears is also 80%. To receive as much of the incentive funding for that particular performance outcome as we can.
Okay. So in arrears, that's the one that we're probably lagging in some, but the others are pretty much we're above the target.
Current support and arrears are the two that we struggle with the most to reach our maximum amount of incentive funding that we could get is current support and arrears. And we strive, again, we're doing everything we can every day to increase those. Current support is what is owed, current every month. And of course, arrears is what, when somebody falls behind on their payments, that is how much they, when they owe back payments, so to speak.
Okay. Thank you much.
Sure.
Are there any other questions that we have for Mr. Ayers? Okay, kind of quiet today. We will move on to our next report. Thank you so much, Chris.
Thank you.
Appreciate what you do. We will have the OFI update by Mr. John Holman.
Thank you, Madam Chair, board members, and Commissioner Brose. I'm John Holman, Deputy Commissioner of the Office of Family Independence, and I'm here to share some updates with you today. I've changed my format a little bit this time, so it's not all bar graphs from OFI today. I've entered some new stuff, so feel free to give me some feedback as we go through this presentation. But I tried to make it a little more interesting with some pictures today. We go on to the next slide. We'll kick things off. Since our last meeting, me and my assistant deputy commissioner over the field, Wesley Merritt, completed a listening tour of the state. We called it the OFI Roadshow. The purpose of this was to hear directly from the workers, to make sure that we're focusing on their biggest challenges and to get some feedback on some proposed changes that we have in the works as well. My favorite joke to start every presentation was, I haven't been in charge long enough for any of their problems to be my fault yet. So I was trying to encourage truly honest feedback, let them, really have an open forum to let us know what's going on. I don't want to spend time and resources on solving a problem that's not a true problem for them. So that was the point of this. We kind of broke it up into three major topics I have here on the slide: people, processes, and technology. But really, what I wanted to hear from them is, we've been doing a lot of overtime recently, and I wanted to talk to them about how to improve participation in that overtime. I've heard that the supervisor role is the hardest job at OFI. So I wanted to hear from them about how to improve that position, maybe how we can alleviate some of the stress on those folks and make that a more desirable position. We're also looking to implement a new task routing system, which is basically how we distribute work. So getting some feedback on that was one of my priorities as well. And we're also rolling out a new career path on actually effective this Friday. And so wanted to socialize that as well. But we ended up hearing back from them as well. A lot of stuff they brought up. We have implemented a new 13 cases a day. We've asked them to complete 13 cases a day to really push them to make sure they're meeting capacity. You know, we're not firing people who can't process 13 cases a day, but we are, you know, if you aren't, that kind of triggers a conversation with your supervisor to make sure there aren't any barriers, make sure there aren't any trainings that you need or any areas you need more help with. So just pushing people on that, you know, and they kind of let us know they are at capacity, I think is a nice way to say the feedback we got about that. They are working as hard as they can, and you know, that standard has really been something they've had to strive to meet. They gave us some good feedback on how to provide more support to new workers. They suggested some improvements to Gateway, improvements to how the registration team works and how we work with our customer contact center, which is our call center. So a lot of really good feedback from the field on things that we can improve in the short term, and also some things we can work on a little bit in the longer term. So it was a really good experience for me. Selfishly, I learned a whole lot, and hopefully I've heard some good feedback from the field as well, that they enjoyed the opportunity to present, you know, their issues and challenges to leadership. Myself and my Assistant Deputy Commissioner, Wesley Merritt, were there, and also the district leadership for each district was present. And some of our, you know, our deputies, you know, Stephen Pollack, Rachel Redding King, and our statewide team leadership was all there too as well. It was a really good experience. My second favorite joke from our time on the road show was that, you know, it was Wesley's joke actually, they wouldn't approve his travel expenses if we didn't take a group photo. So if you go on to the next slide, you'll see we took some pictures with most of the folks. I'm not sure if we got everyone, but I think you skipped over the first one maybe real quickly, but we tried to go to 2 offices in each district. I think we did that in most districts. We ended up getting to 14 offices in both customer contact center locations. So, you know, you'll see here Muskogee County, Troup County, Ware County, Richmond County, Fulton, and DeKalb. Here, those were good groups, some really big groups in there, and we had some smaller ones too. If you go on to the next slide, you'll see, you know, some of our Dublin, we had a little smaller crowd, but you know, Clayton and Chatham, you have very big metro areas. You know, Valdosta here too as well. Great group of people, great feedback from all of them. On the next slide, I think I've got a couple more pictures. We'll make sure, I think y'all get these presentations, but hopefully we'll share the pictures with y'all. It was a really good experience to get out and see everybody and hear directly from some of the folks in the, you know, in the counties. I realized how large the state of Georgia is again. It's always good to have a reminder. I added up all the miles and I drove over 2,000 miles over the course of 2 months. So we did it every Thursday and Friday, or almost every Thursday and Friday of the months of September and October. So a very good experience there. Feel free to ask questions throughout my presentation. I like for this to be, you know, interactive if it can. I'm going to move on to the next topic though. Here, I wanted to highlight some successes we had over the past. This has been a year-long project, or year-long initiative. You know, we have American Rescue Plan Act, or ARPA funding. We got from FNS over the last 3 years, and this is the federal fiscal year 23 projects. We were able to complete many of those. We have a few that are still ongoing. Just the rollout of them is completed. But I want to hit on these projects that we went through over the past year as they came to a conclusion at the end, or many of them concluded at the end of the federal fiscal year in September. On the next slide, I kind of have I'm go through these slides for each one. So staff retention and acquisitions, we use some of the money to pay supplements to our staff. This we actually did with 22 and 23 money. So some of that was supplements to staff until we could get longer term compensation increases for our workers that happened through the initiatives of the governor and the legislature to provide pay raises to everyone. We also used some of the money for overtime that was done during the summer. And we're, you know, the SNAP or FNS, the federal government, our federal partner in the food stamps or SNAP program, does cover 50-50 for all of our workers, and we are allowed to use ARPA funding to cover that other 50% that's usually on the state. So we used a lot of it to support our staff. On the next slide, you'll see we did a big technology project we were able to do. The federal government gave us some guidelines, and technology projects was something they were pushing really hard with this money. It's a good thing to use, one-time funding on. We built a disaster SNAP system. So disaster supplemental nutrition assistance program, pre-registration system. So if I don't know if y'all were around for Hurricane Michael, but when that came through, we had to do a big operation to make sure that those disaster benefits went out to folks. And, it was a pretty manual process, where we set up tents. We had our sites all over the affected area where people could come and submit applications, but those are paper applications. And they had to bring those to a worker who had to key them into a system. And there's a lot of documentation you have to provide as verification throughout this process. So we're trying to move this online. So, hope I never need to use it. But if the next time we do have some type of disaster that triggers a DSNAP event, or DSNAP program, we can use this online system to hopefully, increase efficiency. You can log in. We built it on the ServiceNow platform, and it's mobile responsive. What the idea is that the clients will go and they will complete their application. We technically have to call it a pre-registration because it's not an application until you actually complete the interview with a DFCS worker. But they'll get all their information into the system, and instead of the worker having to manually enter that information during the interview, they can just confirm the information is accurate, collect any needed verification with the client during the interview, and complete the process a little quicker. So, this is a portal that we built that hopefully will last for the next 10 years. It's built outside of the gateway system, but integrated with the gateway system. So I hope to be able to keep it past the lifespan of gateway. But very excited about this accomplishment. It was a big project, and we only had a year to do it. So it was a good one. On the next slide, you'll see we placed QR codes on all of our system generated forms. So these allow us to do a couple things. If we send out a notice and it comes back returned undeliverable, we can scan that QR code and trigger an automated process to attempt to update the contact information of a person, or we can also trigger some outreach to that person and try to get them to update their contact information if we don't have a better address for them. It also will allow us, if a customer completes, we send something to a customer, they complete it and send it back to us. It will allow us to scan that into our system and tag it to the client and the case. So a lot of things that come back in physical mail get lost in the shuffle, or have the potential to, because they're manually, or at least previously, they were manually tagged to a person in a case. And this just automates that process, so less chance for human error in that process. So this has been really great. We've also already seen the benefits of it, and we were able to build on it to build out the automation of we centralized all of our return mail and automated the process to do outreach to those folks as kind of a build on of this QR code project. Next project on the list is work numbers. So this is an interface that we use to verify the income of our clients. So if we didn't have this interface, we would have to ask clients to submit proof of wages or income or employment, and we're able to do that electronically without having to do that from this service. It's part of Equifax, or they provide this service. And there's a cost share across programs. The next one was pretty interesting one, I thought, too. We worked with the University of Georgia to do a hunger study. So it's kind of a partnership between DHS, the Georgia Food Bank Network, and the University of Georgia. And it was a really interesting study. They just sent it over to us in September. I think we're going to do some kind of maybe some publicity around this too. So it offered a lot of insight into how to improve food assistance and make the work of the SNAP program and the work of the food banks a little bit better. A lot of great data on food pantry operations, a lot of data from clients. And they had some specific recommendations for us too, and they helped us target underserved areas so that we can do maybe more SNAP outreach or outreach about SNAP enrollment. They highlighted some areas for cooperation between the food banks and DHS, and they identified some barriers to SNAP enrollment that are, action items that we can take away and try to increase things like, accessibility, education, and there were some transportation issues in there too, which I thought were interesting. So this is a great partnership between the University of Georgia. We worked with Dr. Lee there, who is, and some other folks who have been working with the Department of Aging Services too. So continuing that relationship with the University of Georgia. We have two more. I got two more projects on my list. The next one is field staff phone system. So, when COVID happened, we, very rapidly switched from working in offices to working at home. And, that remote work model has proved successful. But, we're starting to build out, if that's going to be a long-term thing, we're trying to adjust our infrastructure to accommodate that. So, we very quickly gave people the resources they needed to work from home, and I'm just trying to make that a little more better, I guess is the way to say it. So, they were using a soft phone, which is like an application on your computer to call people called dial pad. Some folks were also using state-issued cell phones, which, are good at making calls, but not if you're on the phone all day. So we're switching them to the same software that our customer contact center uses. So same technology as the call center at DHS or at OFI. So and add some additional functionality so it can transcribe the calls so that the caseworker doesn't have to be taking notes the whole time. It keeps a call history that we can use for audits and hearings of when we attempted to call people. A lot harder to pull that from a cell phone or the soft phone we were using. Allows the supervisors to listen in, barge in, join a call for somebody who's training. So it's a lot of new functionality. There's some other stuff too, but it's just a whole soft phone platform instead of just the basic functionality that you would have if you had a cell phone or using that very basic dial pad software. So hoping this is going to improve the experience of our caseworkers and allow them to work from home, continue to be successful working from home. It's also cheaper. That is another very nice benefit of this system as we're able to transition people off of the old system. We are currently, I think we have we did the dial pad users, then 5 phases of cell phone users that are about 500 people each. We're currently in the middle of phase 3 and are estimated to have everybody rolled over in the first quarter of 2024. Next slide. I don't know how many people have to interact with our policy and manual system that we have online called Otis, but it's a bunch of PDF documents that are linked to other PDF documents, which does its job of displaying the policies, but it's not a very user-friendly system. So we are upgrading that system to a new, we're calling it PAMS, the Policy and Manual Management System, but it's just going to be more like a Wikipedia page or some modern website that you're used to seeing where you can search very easily. There's navigation tools. That picture is very small, so sorry if you can't really see it that well, but it's just a modern website that applies a lot of that new functionality. And so the idea is that it's a good foundation for us to build off of. So it'll have that navigation and search capabilities, but in the longer term, the back end of it now makes it easier for us to link up. If we wanted to build like an AI chatbot is something we're talking about now, so that caseworkers, who have questions, there's only so many people that can answer their questions, but give them another resource to ask a question to that could answer their question. And the dream in the long term is that the code base we're building this new policy and manual management system on could be linked up to automatically update that chatbot whenever policies change. It'll change the answers that are given to caseworkers when they ask questions automatically. And when, eventually we hope that we can integrate it with our eligibility system so that when policy changes, it will automatically update the business rules in the system, preventing the need to, go through a long release management process with the vendor. So that's the dream. I think the chatbot updating automatically will be a little easier than updating a system automatically, but it's building a foundation that we can make long-term improvements on, and hopefully it'll something that can stick around for decades because of its usefulness. That's the end of my ARPA project presentation. I'm going to move on to the next segment. pause for questions. Okay, so
Can I have a question?
you may, please.
My name's Dave Barbie in Augusta, and I want to go back to slide 41. There. Help me understand what we're looking at with these ink dots. What are we, when you say raw approximate score, what does that mean? And then on the other one, it says score adjusted for the population. What are we talking about here with these, lack of a better term, I call them food deserts? How's this work?
Yeah, so UGA actually did a very comprehensive like GIS analysis. They plotted out all the resources that are available to, throughout the state, identified all those, and then showed how close or how far away someone is from one of those resources. And I believe, there were a lot of graphs that they included in their report, but I think this specific one is proximity or distance from one of our offices, I believe.
Oh, from the offices.
Yeah, that's what I believe this. This graph is. I think that the full report is available for us to share. So I'll make sure that we follow up this presentation by sharing the full report with you. I will warn you in advance, it's hundreds of pages long. They did a very thorough job. But there's a table of contents in there, so you can skip around. But I don't want to kind of take this piece out of context. I think my communications team grabbed a map out of here, but that's what a lot of it was seeing how close folks were to resources to try to identify, maybe it's harder for them to have access to food. People in certain areas have more access to food banks than other areas. Some people, we have an office in every county, but really it's seeing what availability I think of. I think this actually may be some of the food bank resources, not the DFCS offices. I may have misspoke there. That's why I don't want to I'd like to share the whole report with y'all, which I'll make sure my team gets out to all board members following this.
Well, I was just trying to curious about, the dark blue and then the light beige, and then there's no color on some, and I'm just trying to figure out what areas are we deficient? Is there something we could do about it? Is there, is there a plan for the future to try to correct any of these deficiencies? And that was the reason why I was looking at the map. I couldn't tell.
For sure. Yeah, and that is what it kind of says. The purple areas you see here are a little, further away from resources, and with the orange ones a little bit closer. So it's highlighting the outliers or the extreme cases there, with the non-colored ones being kind of more in the average.
Okay, all right. Thank you.
Yeah, no, they did a very good job. They broke it down by region. The food banks work on a region model, so there's a regional breakout of where they can do more and where they should concentrate their resources. Really, they were very excited about this being like a real groundbreaking study in a couple areas. So happy to share that with y'all, and I'll make sure you get it following this meeting. Okay, we're about halfway through Medicaid redetermination. So if you don't mind, go back to slide 44. This is kind of the first one. I know I've talked about Medicaid redetermination to this group before, but just wanted to kind of provide a little bit of information. We're all states have to go through this process. In Georgia, we have 2.8 million members on the Medicaid, at the beginning of the process. So doing a Medicaid renewal for all of our members. And so, y'all know this, but I'm just going to say in case, for context for everyone, the Medicaid renewal process is not new. Prior to the public health emergency, Medicaid members were required to renew their coverage regularly, and those requirements were suspended during the public health emergency. So Medicaid redetermination is really just a return to that normal procedures. So our existing clients, haven't been through that process though, in 3 years, and many of our new clients have never been through the process. So we want to make sure that all eligible Georgians keep their Medicaid coverage. So we've been doing a massive education campaign, and that's what kind of I've highlighted here on this, and then going on to the next slide, outlining, a lot of the things that we've been doing. If you don't mind going to, yeah, here we are. So just highlighting some of the accomplishments of that campaign. We've done digital advertising, social media. We've reached 111 million impressions. So that impressions kind of a fancy way to say views, or an industry term to say views. Within that, television and radio that have reached 14 million, obviously not people, because they're not, that those numbers are higher than our total population, but times that we've hit people over and over again with these television, radio, and digital media campaigns. So we've been meeting regularly with our community partners and hosting events to share information, joining their events as well. Doing a lot of media outreach, outdoor advertising. We have billboards and bus stops. We're putting signs on the next slide. I've got a couple more things. We've been doing some pretty targeted outreach as well, trying to use some of the data that we have or have been receiving over the time period. Areas that we're seeing lower responsiveness than other areas, trying to target them and send out direct mailers. We have some data about who's logged into their account and who hasn't within a certain time period. So folks who haven't accessed the Gateway customer portal in a year, we sent a postcard to every single one of those folks. So I think it was a little over 100,000 people that fell into that category. So sent them mail directly to them to try to make sure that they're aware of the Medicaid redetermination process, update their contact information so that they'll be getting those notices, when they do go out. People will know when it's their turn to submit a renewal. So participating in public events too, and we have, teams of folks that are going out to healthcare providers and clinics, that really trying to train the people where they interact with their healthcare providers and making those healthcare providers an advocate for us, or, at least assisting us in the process of getting folks, keeping folks on the rolls that are still eligible. So just wanted to share that quickly. And then I'm going to transition into my, I kept the bar graphs so no one would miss them. So I do have these as well. I'll go through them. I think they do still tell a good story through the data about what's happening in NOAA. So, some of the story is exaggerated by the scale over here on the left-hand side of the screen, but this is unduplicated families served across all programs. And if you'll remember, we had a jump here in May because of how we were reporting people who were in the Peach Care for Kids program. So, would it be more even if not for that reporting issue? But we are starting to see kind of, a little bit of a tailing off of the total families of unduplicated here, which I believe, and I'll continue to talk about this over the next couple of slides, is more of a, end of the public health emergency and, a caseload normalization that's happening. On the next slide, you'll see we also have caseload size continues to decrease. So caseload size is really that first slide you saw, the number of families that we have to serve. And then if you see on the next slide, the number of people we have to serve them. So frontline staffing levels jumped, pretty high, in May, and that was because of a big release of folks from training, a big push of hiring that happened, or it's still happening. We have, it would be more of a trend up, but I think I've messed up our reporting with some of the stuff that I'm doing. We've managed to hire over 1,132 new caseworkers as of the middle of November. So that's an incredible number of people that have come on board. And, I think the true number of folks we have right now that are completing casework is closer to 1,600. But I have pulled some people out of the queues so that they can work on priority things for me. So I think that's skewing our data here a little bit, but just, they're working on some things like our SNAP renewals, Medicaid redetermination, and the new pathways programs. I pulled them out of those traditional queues. They get counted in this. So I think we're really truly around 1,600 caseworkers right now. But just wanted to add that context here. On the next slide, we start to get into our program specific data. So, the average issuance per family is about 392. This is total issuance is kind of, you can see this trend. If we go to the next slide, it mirrors the SNAP family trend that we see here. So, this is a slight decrease in what we've seen before. And again, I think that's with some of the trending back towards a normal caseload. Before the pandemic, we were, hovering around 600,000 to 700,000 families. During the pandemic, we went up to about 700 to 800,000 families, and now we're getting back towards where we were before. And so, you know, looking at the denial reasons, kind of try to dig into this a little bit before the presentation. Most of it, you know, it's folks who, you know, don't submit their renewals. Always is a very high number of folks, but we had, you know, the resumption of the work requirements was something that had to happen. That started happening in July 1st. Folks started having to do that work requirement piece for SNAP that were, we call them ABODs, but able-bodied adults without dependents. You know, we're required to do work participation again. And we also had a lot of folks come in over income. So those are our big three categories of folks, reasons why they're denied when they go to renew. But, you know, this is, you know, we are seeing a slight downward trend in the total number of participants in the SNAP program. Hopefully that's due to improvements in the economy, but also expiration of some of those PHE flexibilities, public health emergency things as well. On our next slide, I think this is still SNAP. So applications and renewals, very high level of number of renewals. We're still seeing a ton of those and processing a lot. So, you know, you don't see the historical data, but I went back and looked at it, you know, these numbers usually previously we were around the 80,000 mark, and we've been hovering a little bit higher than that, you know, in the 120,000 number mark for a number of months now. So renewal workload is very high right now, as well as applications. So the next slide, I think I transition over to Medicaid, and you will see, you know, we started at our last report. You may remember we had started this kind of first step downward, and you see that has continued through the Medicaid redetermination process. You know, again, the scale over here on the left-hand side is exaggerating the story a little bit. You know, the difference between this high number here of you know, 1.17 million, you know, down to October, which is, you know, a little over 1 million, 1,042,000, I believe is the October number. So we are seeing that kind of gradual decrease as the Medicaid redetermination process happens. You know, a lot of folks are completing that process, but some folks, you know, a lot of them no longer eligible during that re-examination of who's eligible. On the next slide, I have kind of another look at the application process. You know, October 2022 is as far back as this goes, but if you go back even further, our normal number of applications that we received during the public health emergency or over the past couple of years is usually about 50,000 applications per month. And you know, that public awareness campaign, I would like to say, has been very successful. There has been a lot of interest in Medicaid. You know, it really kicked off in the fall of last year, so we saw a pretty big increase in SNAP applications that happened around that time period, and that has been sustained. So this work, this is a significant workload for our staff. You know, going from 50,000 applications a month to where we're now hovering between about 150,000 and 200,000 applications that come in, and these are ones that have been processed per month. So it's a lot of work. You know, we try to direct folks towards, you know, you don't have to submit an application to renew. You actually submit a renewal, so those numbers are not included here. But a lot of folks are submitting applications, you know, just because, you know, it's out there. You know, you need to keep your coverage, and sometimes folks will do an application instead of a renewal. But you know, if folks do fall off the rolls but then become, you know, eligible again because of a change in circumstance, they would need to submit an application at that point if they were if that happens. So continuing to see this high level of applications well above our normal 50,000 range. I think the next slide might move us into TANF. TANF issuance, and the slide after this, the TANF population remains pretty stable, I would say. If you want to go to the next slide, I don't have a lot, there's not much of a story to tell here. It's you know, relatively unchanged over the period. And my last slide I have here also shows TANF applications, approvals and denials. Approvals in the blue here, denials in in orange, and total processed is a combination of those two bars in that gray color. And this again, I think I say this every time, but the big difference, the high number of denials, is because we do have an integrated eligibility system, and which makes it very easy to apply for all programs at one time. So a lot of folks apply for TANF that don't end up being eligible, but it's very easy to submit an application for SNAP, Medicaid, TANF, WIC, childcare through the Gateway customer portal. And that is my last slide, I believe. But I'm ready to answer any questions that the board may have.
Do we have any questions for Mr. Hallman? Okay, thank you so much, John. We appreciate all the information and the hard work that you and your staff do. Thank you.
Thank you.
We will now move on to Child Welfare Update by Mary Harvick.
Good afternoon, Chair Fletcher, Chair Dorsey Mott, and members of the boards. My name is Mary Havoc, and for our child welfare update today, we're going to do a deeper dive into some of our technology modernization efforts, along with highlighting some of the chances that we have had in recent months to celebrate and learn as a child welfare team. Next slide, please. When Commissioner Brose got here, one of the first things that she did is make modernizing technology and child welfare a key priority. And so we have been hard at work at that over the past couple of years. Specifically in 2023, there are 4 pieces of technology that I want to share updates on. So Argo placements, we launched that statewide this year, and it allows the placement search to be done across all placement types. And I'm going to go into more information about each of these, but wanted to hit some high points. Our Argo community portal made our network of providers that deliver services to families and children stronger than ever, and we onboarded 98 new providers to that portal. MCASE, which helps our case managers do their work remotely, has been up and running statewide. And then finally, we launched phase 1 of Georgia Communicare in regions 2 and 5. Next slide, please. So Argo placements, we have been piloting this for several months in 2 regions, and in October we launched it statewide. And Argo placements connects directly to Georgia Shines, which of course is our system of record, and really supports and creates a more efficient placement finding process for our staff. They can search for a foster home or a group home for a child by matching the child's needs to the home's attributes. And it also creates the necessary paperwork electronically to apply for any placement type, leveraging all of the data that currently exist within Georgia Shines. So when our case managers use this system, they're going to get a detailed search results that show the placement locations and the best fit for the child's needs, contact information for the selected placement locations, and then a shareable application, that paperwork that they can use to initiate the placement of the child in a home. Next slide. So this gives you a sense of what Argo placements looks like for our case managers as they begin the search process. They will enter the child's needs and then the type of placement that they are searching for. So it can retrieve foster homes, both public agency and private agency foster homes, as well as all of our group home resources, independent living resources, along with maternity homes. Next slide. And this shows you what the detailed search results look like. So after they have entered that search, you can see here what the results look like. And the case managers are presented with a list of homes that each receive a score. And that score is based on the location of the home, the school district, the placement characteristics, along with the current capacity in that placement. And this is available both for all of the homes, which is what you see an example of in the top box there. And then the bottom one lists group home settings that are resources. And then when case managers click into one of these available options, they get more detailed information. And on the next slide, you'll see an example of what they see with the home detail. So here, it's automatically loaded in, and they will be able to see how that resource matches up to the child's needs and exactly where the matches are and where there are any mismatches. If those exist, they can also access detailed information about the home or the resources, current capacity, the other placements, distance to relatives, along with that home's interest if it's a foster home. So we've been statewide since October, and so far have received positive feedback on this tool, both statewide and then, of course, with our pilots we did as well. Next slide, please. So our Argo community portal, this was launched in 2022 and allows us to really be able to connect and interact with our delivered services providers. And delivered services providers may provide services such as parent education training or in-home counseling or transportation. So this could be for a child or parents when the child is in foster care and the parents are working a reunification plan, those types of services, or if the case is in family preservation and the children remain in the home and we are providing services. So it covers all of those and provides a platform for our case managers to really engage providers directly. And so it eliminates them having to pull up lists of available providers and do research about which providers may be a good fit. And it also provides an opportunity for our providers to manage their workload and gives providers access to service authorizations where they may be able to work with a new county that they weren't otherwise engaged with, because the service authorizations go into the portal and then the providers can accept it if they are available to complete that service. And in the last 6 months, we have had more than 100,000 requests come through the Argo community portal. So lots of work certainly happening in this space. Next slide, please. MCase, which is our mobile application for case managers. And you can see we've got a couple of screenshots of what MCase looks like to our case manager, but it allows them to access forms, minimizing the need for them to carry paper forms with them out into the field. It allows them to see their caseload. They can upload photos directly from their mobile device that will then go into Shines. They can collect electronic signatures from parents and overall reduces the time frame for them to submit documentation since they can do it on the go. Next slide. Georgia Communicare is our latest technology innovation, and we have launched phase 1 of it just in September, so it's still very new. We did our launch in regions 2 and 5, so they are leading off this effort for us, but in early 2024, we will begin our statewide rollout. And Georgia Communicare is a set of interconnected web portals that are designed to enhance and support communication, particularly for foster care cases. And it serves 3 primary user groups. The first one is court-appointed special advocates, or CASAs. The second one is foster parents. And the third one is parents. It seamlessly integrates with Georgia Shines, so it pulls all of the information from Shines that each of these parties are entitled to receive and makes it available to them. We are going to be launching an app with Georgia Communicare that rolls out in regions 2 and 5 in December. So in just the next couple of weeks, the app will be up and running. Next slide. So this kind of shows you each of those parties and how they can communicate with each other in a diagram. And it is designed to streamline that communication and really create an extra tool to support it. Before Georgia Communicare, our foster parents, and CASA partners they didn't have a way to access information from Georgia Shine. So they would have to request information from a case manager, which, really causes a backlog with information request. Now, these parties can also talk to each other in the system. It has a chat feature, and it has the ability to share documents. So for example, if a foster parent has the most recent report card for a child who's in their home, they can upload that report card in the chat to the case manager. The case manager can look at it, approve it, and then it will automatically go into Georgia Shines, at which point it would be available, for example, to the CASA volunteer. So in addition to these parties chatting with each other, there's a calendaring feature, so they can request appointments. And at some point in the very near future, I think this is part of our December update, you will be able to, after that appointment is scheduled, download it to your calendar application of choice, so it would then show up in your electronic calendar. If you so choose, it also has a feature that you can opt in for text messaging so that you could get updates that perhaps you had a new message in Georgia Communicare. We're excited about the potential of Georgia Communicare, and of course, along with all of our other modernization efforts. Next slide, please. So it's November, and we are wrapping up National Adoption Month, and pleased to share with you some of the things that we have done to celebrate, starting with Governor Kemp proclaiming November as Adoption Month in Georgia. And we've got 2 photos here from an event that we held that was a family matching event hosted by our state adoption unit, which serves as an opportunity for our staff, private agency staff, and families who are looking to adopt to meet together, to network, and our staff are able to present children to families interested in adoption who are free for adoption. We were able to recognize an Adoption Case Manager of the Year, and for 2023, that is Brittany Sullivan. Super excited for Brittany, and she's certainly deserving with her dedication and all the work that she has done to help children achieve permanency. And then in addition to these statewide efforts, several of our regions across the state held their own local adoption events recognizing National Adoption Month, shared information about the adoption process in Georgia, and then it's also an opportunity to create awareness locally for children who are still looking for their forever homes. Next slide, please. Little data look at adoptions in Georgia. You can see this is for state fiscal years 2019 through 2023. And I'm pleased to report we had a slight increase for 2023 with 1,275 adoptions that were finalized. On the next slide, you can see broken down by month adoption finalizations. And we certainly had a big month in May, and we are excited to see what November and December bring for us in terms of adoption finalizations, because they are always record months in the year. Next slide. September was Kinship Month. And we celebrated in Georgia by hosting a forum for our kinship families at the Methodist Children's Home in Macon. So it really served as an opportunity for those kin caregivers to get education, but also some peer support and engage with other folks who are caring for their relatives. And we were excited to have families from all across Georgia join us at this forum this year. Next slide. Each quarter, we host a summit for our county directors and other leadership staff. It is usually held virtually, but it's an opportunity for these folks to come together, get information on statewide initiatives, but they also provide valuable feedback from their perspective on projects, as well as an opportunity to brainstorm, what ideas for improvement across the agency that they may have. And we were pleased in July to be able to gather together in person for 2 days. So in addition to professional development, the opportunity to collaborate with peers, we were pleased to be able to offer them a chance to update their professional headshots by one of the talented members of our communications team who provided that service. Next slide, please. Together Georgia is an alliance of many of our providers that provide, whether it's placements, so a lot of our private agency foster home providers, as well as some of our group home providers and direct service providers have this association, and they host a conference every year that's called the Georgia Conference on Children and Families. It was held this year in October, and so in addition to all the learning opportunities that exist in the conference, they also each year hold an awards ceremony luncheon and recognize folks across the state. We had 2 team members who were recognized. The first one was LaShawna Taylor, who is a case manager in Lawrence County, and she won Outstanding Child Welfare Professional Award for a state agency. And then one of our Parent Advisory Council members, Samantha Valentine, received the Community Partner Award. So congratulations to the 2 of them. Next slide, please. There we go. And finally, earlier this month, we were pleased to have Rebecca Jones Gadsden join us here in Georgia. She is the Commissioner on the Administration of Children, Youth, and Families at the Administration of Children and Families within the U.S. Department of Health and Human Services. Quite a mouthful there, but we were very pleased to have her. She came to Georgia to meet with other leaders, us along with other leaders in the Southeast of public child welfare agencies. And since our federal partners are housed here in Atlanta, we had the opportunity to showcase some Georgia work for her while she was here. So she met with a kinship support group. She met with a youth placement work group for older youth that Together Georgia is leading up, that we're part of. She met with our youth advisory council members. and met with representatives from the Adoption and Foster Parent Association of Georgia. You can see there's several photos there of her at those meetings, and we were thrilled to be able to host her while she was in town. That wraps up my presentation. I'll be glad to answer any questions that you may have.
Let me ask you something. When we find a child, or how much of it have we found, a child that has been misplaced when we're using the new system, what do we do and how much of it do we have?
We haven't found necessarily any children that have been misplaced, if you will, but the system is really designed to help us find a placement. So it doesn't evaluate, we haven't used it to evaluate an existing placement. Instead, we're searching out new placements for children. So I can't really answer that question, but
Okay.
you know, we have had a lot of success with the matching that has happened with this system. And really, it's designed to help guide our staff in the right direction because we have lots of placement resources across the board. And so help them have a better starting point.
Okay, maybe I interpret wrong, but on one of your slides, I thought it said it helped to find misplacements, and that's why I asked that question.
There was a slide where I mentioned that when you go into the detailed search for each of the placement resources, you can look and see for that family and that child, like what are the things that align and if there are some that don't align. So for example, let's say that the family and the child aligned with characteristics, but the family was located far away from the child's community of origin. That would be a mismatch because we want to keep them as close as possible to their community of origin.
Okay. All right. Do we have any other questions for Mayor?
I have a question.
Yes, go ahead.
Hey, this is Jennifer Shimpo. Back to the data sharing application between foster parents, CASAs, caseworkers. When people upload that information to the system in the portal, is there an alert system that goes to a case manager that, you know, says, hey, new information has been uploaded about this child? How are we checking to make sure and holding people accountable that they're actually aware that that information is being processed and put there?
So it does have, we have added the text messaging feature that I mentioned earlier, right? And then it does generate emails that, you know, there's activity in the system.
So is there any way for a case manager to go in and say, check it off and say this has been viewed by chance?
Yeah, because then it will generate an alert back to the person that uploaded it. So if a foster parent, for example, like I used the report card example before, right? If they review and approve that, then it will generate an alert back to the foster parent.
Okay, great. Thanks for clarifying.
This is Lacey Tibbetts, Region 11. I have a similar question with that software. Have y'all considered allowing or expanding on that software for guardian ad litems to have access as well? I'm a guardian ad litem in a lot of DFCS cases, and I'm usually the last to find out anything. And if I had access to similar, I mean, if CASA can see it, I feel like I should be able to see it.
Okay, we'll take that and consider it. We haven't had those conversations yet, but we will take that back. The good news is we're really still pretty early on into this since we just started our rollout of it. And with modern technology, we have found that, you know, as we identify things that we want to enhance, or if we find a glitch in the system, it's much easier to fix and update, if you will, than our system of record, Georgia Signs, which takes a considerable amount of time for updates to be made just because it's an older system.
Okay.
This is Allie in Region 12. I had a quick question around, is it AdCore? Is that the placement tool?
Argo.
Argo, sorry, I wrote it down wrong. Okay, with Argo, will that tool help to prevent, like I know what's happening here and I understand a little bit around the why, but you know, around foster parent and burnout prevention. It seems to have become common practice that caseworkers are having to give a list of families that they've called to show that they've tried to find placement. And so we're seeing a lot of families that are getting calls. And honestly, the caseworker's like, I have to call you. I know it's going to be a no. But that definitely burns people out, right? You know, people that want to be able to take placement. So is the hope that this system will help eliminate that practice that's kind of been put in place?
Certainly, it is designed to help us like start at the right place, right? So that we're not having to call just this long list of individuals and make calls that really aren't good matches, because that's not a good use of anybody's time, right? And it happens with foster parents as well as with our group home providers. So it's absolutely designed to help us be more streamlined and efficient and, you know, be making the right matches early.
Okay, because I think, you know, currently that practice is definitely wearing down, you know, the foster parents that we deal with in our region. That's becoming pretty taxing. So, and this is statewide already, is that right?
It is. It rolled out statewide in October.
Okay, great. Thank you.
Yeah, thank you for the feedback.
All right. If we don't have any other questions for Mary, we thank you for your time and your report. Very interesting. We will move on to the Office of Inspector General presentation by Ms. Wanda Houston. You're on mute.
Just when I thought I had it together, I was ready to click it and missed it. Good afternoon, Madam Chairman, board members, and Commissioner Rose. I'm Wanda Houston. I'm the Director for Internal Audit within OIG. Next slide, please. With OIG, before Inspector General David Lenore gave you guys a presentation, we have 5 units. Benefits integrity, background investigations, residential child care licensing, internal investigations unit, and today we're going to talk about us, internal audit. Next slide, please. For internal audit, we do the audits for the agency, all divisions, programs, and even sometimes offices. What we do, we get for our investigations, we get various requests from different areas, as you see. Interagency requests for investigations, our email addresses, the hotline, private citizens call, and some of our governmental partners. Next slide, please. Our mission for internal audit is to provide a systematic, disciplined approach to evaluating and improving the effectiveness of the internal controls of, you know, various programs and the money that we get from the feds, from our state money overall, and also the procedures and risk management to help these areas be better at managing certain things and getting funds out. So next slide, a little history. Not gonna bore you with a lot of it, but over time, the Office of Audits is what it used to be called under DHR. As you will see from this slide, prior to '83, we had 61 staff for audits. So they had 5 sections. They did various things from contracting, DFACS. They did the financial statements for county offices. They had the health section, internal section, and operations. And then over time through budgeting, you know, just the split between DHS and DHR, and then public health went their way. We had just various changes that happened. 2009, it was a restructuring that occurred. And that's when DHR went to DHS. Public health and Department of Mental Health, you know, split out from our area. And then the Office of Audit's name changed back to internal audit. And so when those splits happened, staff from internal audit went to some of those areas as well, so they could have staff that could also handle the internal audit process. 2013 to now, we've lost 17 staff. Currently, we have 11 staff, but since that time, we've lost some more staff. So currently, we have a total of 8 staff available. Next slide, please. Our responsibilities. The long and short of everything, we are actually the second line of defense. I say the second line because the first is the program or the office or the division who knows the program and knows the area and knows their funding and what they're supposed to do and have oversight. Internal audit is that second part. We're the ones that try to ensure that these areas are doing the things that need to happen. One, so when the feds do come in and they do send their auditors in, that we are aware of any issues that may have arisen. Or when our Department of Audits and Accounts come in, state auditors come in and they review things, they are aware. And we know what is going on, so no one is actually in the dark. And so for internal audit, we try to participate in those audits to try to be the to take the audit speak and turn it into layman's speak so that the agency is giving the auditors exactly what they're asking for to meet certain requirements. Next slide, please. So our functions, we do the audits and we base them on risk for most times, but we have standard audits that we do. We evaluate like our regional accounting offices for DFCS. Those are kind of our standard ones we do every year, mainly regions 13 and 14 because they are the larger ones. But we also perform desk audits on the other regions as well. We do compliance audits, which kind of mean we go in and we're looking at some of the federal requirements to make sure that, for instance, subrecipient monitoring is happening within the programs, that they are doing them according to what the feds have described in their requirements. We do the performance audits on financials. When we do new contractors, every year we may get, grants go out and someone may want to do business with the department. What happens is we put in place where, as a new contractor, if they've never done business with us before, or they have not done business with us in the last 2 years, we have put in place with the Office of Procurement and Contracts that the entity should provide a set of financial statements. We review those financial statements for viability. We don't determine whether or not you do business with them, but we do look at the financials and let the program know this entity has X amount of dollars in the bank, or they have no money in the bank. But we let that decision lie with the program whether or not to do business with them. One of the other things that we do is various special projects and/or investigations. And I will definitely address some of those a little later, but that's when someone calls in, and they can call in through various ways, send us emails and say, hey, this contractor is taking federal dollars and I know that they're spending it the wrong way and they're giving it to XYZ. We take that information and then we go through some processes to determine whether or not it is a valid investigation, or if we should be performing an audit on it, or if we need additional information. Next slide, please. So, as I said, the type of audits, this is just the type of audits that we do. We do financial, performance, compliance, and investigations. So for the financial side, no, we don't necessarily go and do perform financial statement audits. Again, this is our third party side of the audits. So we may have given someone a contract for the fiscal year. And at the end of each fiscal year, for their fiscal year, they're due to send in their financial statements. That is part of their contract. That is within their contract. They send those financials in to us. we review the financials to determine if they have had any findings related to our funds that we would have given them, for instance. So if they've had some segregation of duties issues, or if they've had some fraud happen within their agency or their entity, then we document that, and we also let the program who issued the funds to them know what those findings are. For performance, we go out and we review regional accounting, for instance. So we will look at how they are processing payments according to foster care payments or TANF payments, restricted funds and things of that nature. Compliance audits, the same thing. We're just checking them to make sure that they are handling the funds according to however they're supposed to be issued out. And investigations. Next slide, please. So some of our audits, and this is our regional accounting audits. These are audits that we do every year. As I stated before, we do region 13 and 14, which are our metro areas. And we also may perform desk audits and or go visit some of our other regions as well if we have not reviewed them in a few years or a year or so. In the last fiscal year, I will say 23, these are some of the findings from 23 and 22 per se, just to kind of give you an idea. So one of our things that we located is there is one account in one of our regional offices that have $1 million sitting on the books. It hasn't been touched since 2012. However, we need to know what those funds are. What are they for? What should they be used for? Because if we're not using them, then they could be, you know, something else should be happening with them. Should they have been returned to the feds? That type of thing. And so when we come across these type of findings, we do put them in a report. We do ask the regions for a corrective action plan. And in this case, for that type of issue, when it comes down to that, we will send it to, you know, either the chief financial officer or executive leadership or something of that nature, so that they can intervene and figure out exactly what's going on with that. So we had 18 various restricted fund accounts, and what those are accounts that can't be spent on anything else. They have a designated duty. They could be client funds that in which a client that we have in foster care may have, funds from child support, Social Security, various things. And with that, those funds may not be able to, maybe the person has aged out of care. We can't locate them. The region has no way of tracking them down. So, you know, there's 111 of those with $347,000 on the books that are dormant. And we need to figure out how to get them over to the state treasury office. However, there's some glitches with that, such as we don't have enough information. And without that information, Treasury won't take it on if we can't provide certain details. So these are things that we come across, and we ask for other assistance to help the region get to a better fit to figure out what they can do. Because sometimes it's just a matter of them not knowing, not sure how much they can do. So we, you know, reach out to other offices like Office of Financial Services, or again, like I said, the CFO when it comes down to money issues. Some of the internal control performance areas that we have found over the past and consistently are segregation of duty issues. And a lot of times that comes from them not having enough staff, and we know that they're short-staffed in the field. But what we try to do is also give them recommendations to help them mitigate some of these. So we don't want to just leave it on to say we don't have enough staff. So we do try to provide recommendations for them to be better. You know, policies, when we see that they're consistently outdated, we bring those things up. One of the things that we have noticed is like staff payroll overpayments. That came up and we discussed it, and come to find out they haven't been tracked in a few years. And so, you know, there really isn't a good tracking. When we had this meeting, there really isn't a good tracking. So people owe us money and they leave, and you find out that they left and they still owe us money, and there's no way to recoup that money. So again, those are things that we bring to their attention and ask, how are you going to fix this? What is a better way of doing this? Travel overpayments. Again, people get travel advances, they go out, or they don't go out, they quit, they have the money, but by the time they realize that it's an overpayment, they're gone. And so sometimes the region's hands are tied because they don't know what they can do to get that money. And so sometimes that's a lot of communication, you know, one hand not talking to the other. One of the things, so for counties, the state may buy certain materials for the counties that are that house our DFCS offices. We found that some of those things were not listed on our books. So if something was to happen in the county or those things were lost, there's no insurance to repay for those because they're not on our PeopleSoft books. So again, that's one of those communication things to figure out what needs to happen for them to get that information. So those are things that we find consistently within some of our regional offices, and we try to figure out how to best help them, like employee exit conferences, or when you do that exit, you need to forward it on, types of things. So we try to give those recommendations so we can mitigate those. Next slide. And so for internal audit investigations, we get allegations. Sometimes the investigations come from our audits. We get various tips. So next slide, please. So our allegation flow, what happens is we get a call, and we've gotten, for some reason, and I believe I'm going to say due to COVID or whatever, we've gotten influx of calls on investigations on various of our contractors, per se, some of our subrecipients. So when allegations are received, we get a call. We go through this process of talking to the program or the division for which the allegation is referred, to us by, or whatever the issue is. And then we try to figure out what's happening. Are they aware? Is it something that they already know? And then we start doing some digging. And based on that, what we tend to do is decide whether or not it is going to be an audit or an investigation. And as of late, we have done audits and investigations simultaneously, because what we have found is the allegations that we are receiving are on programs that we have not reviewed, that we have not done audits on. Not because we don't want to, but honestly, because we just haven't had the opportunity or the staff to do so. Next slide, please. So when we get these investigations, they are usually, like I said before, the agency or the entity is mishandling the money, or somebody feels that they are stealing the money because there are no benefits for them to pass out to clients, or they saw somebody got a raise and they didn't get a raise, and they don't know how they got it, or things of that nature. So that's when we have to go in and figure things out. So we review the allegation. We determine if that process is truly an investigation or not. How much of it should be investigated? Should it go to a different area? And then we reach out to the program and ask if they were aware of it. What's happening? What's going on? And then from there, we decide what we're going to do. Next slide. So from here, again, our investigative procedures, we look at how this
how was the money spent? Was it allowable? Did they do some things that they weren't supposed to do? How much money was it? Is it money that we get back because they misspent it? And we go through all of that, all of those processes. So just like an audit where I can plan the audit and say it's going to take 2 weeks, sometimes, and over the last ones we've done, they've taken a lot longer, somewhere into a couple of months, because there are a lot of pieces to the pie. Next slide, please. So if you're getting into the numbers to kind of give you an idea of what we're dealing with. Over the last few fiscal years, we've received several, more investigations or allegations of things than I've gotten since I've been in this position since 2018. And most of these have been misappropriation of funds. Investigations we have completed and are currently working on. So on the slide right here, what you will see is one of our DFCS regional offices had a bank accounting fraud. Someone sent through some checks electronically. Again, that was an external. We went in, the regional accounting office already was aware. They had already started the process. But for us, just to make sure that things had not happened prior, we went in and we reviewed prior bank statements and performed actually a review of the bank recons from the prior months and waited for the current month to make sure that there were no other issues. Also ensured that the regional accounting office was up to date or part of the payment system so that only certain checks were getting cut or things were being processed. So we took care of that. The Community Action Agency, this one is currently ongoing. And it's, as you see, it's a large amount. And what that is totaling is questionable and unallowable cost. And we say 600,000. And the reason why we say that is because when we're looking in investigations and certain things, we see things that are potentially unallowable. If they are unallowable, which means that they, you have staff who worked on a program, you're supposed to work on LIHEAP program, for instance, you're supposed to be a caseworker on the LIHEAP program, and that is what you do. That's what is being paid. We pay the salary for the personnel. We pay all of these things. But during the investigation or the audit, what we found is that the individuals that should have been working on a particular program was not working on that program at all. So for instance, part of that roundup is all of their salaries for that entire year, for the 3 years that we reviewed, because we were reviewing on a 3-year time frame, that we were paying them, but they were working on a different program. So it's not fraud, it's misappropriation of funds and it's mismanagement. So we're asking for those funds back. You gave, for instance, they gave raises to people in excess of $30,000. So you got someone who got a raise of $5,000 in 5 months, another $5,000 in another month, and you say that it's COVID related, but their job didn't change. Nothing changed. So we say that's questionable. You know, you have one where it may state the contract was ending, so we gave this person, let's pay out this money, we gave you an additional $5,000 because the contract is ending. That's not allowable because the contract is ending. So from an audit perspective, these are things that we look into, and these are things that we say, mismanagement of funds of 600,000. What we have to do then is we give it to the program. The program is supposed to know this subcontractor, this subrecipient, and we've stated what we have found, and we're asking them for a corrective action plan, and also for them to determine whether or not the cost that we have stated as questionable will remain such, which means they get to choose whether or not we keep that 600, whether or not it's 600,000 or they reduce it. So for that particular one, the allegation came in that caseworkers were asking for money to process applications. They would take $100, $50 to $100. You give me $50 and I'll move up your application so you can make sure you get some money or we pay your bills. Now, that type of allegation we're going to look into, but it's very difficult because the client that may have paid the money is not going to say that they gave them money because they're going to feel that they're, either going to be in trouble for giving them money, or I have to deal with them. So I still want to get my application done. So I'm not going to say I gave them money. So, that was kind of difficult, but through the process of the audit and all of that, that is what one of the current ones we're working on. We have 2 service provider investigations currently going on. Next slide, please. So completed ones, again, community action agencies. Those have been, I think we've done 4 or 5 in the last 2 years. Those are heavy in allegations. So one of them, we recouped $30,000 due to the fact that they hired staff that did not pass the background check. So they had to repay back their salaries. We had another bank accounting fraud that happened. We had a employee travel fraud where the person was using the state's resources to rent vehicles and then come back and say that they were personal use. So in the meantime, they didn't pay taxes on any of those things. They did one-way rentals, various things. So on the books was $3,500. And so that was worked with child support and the Office of Financial Services to have the rental car people put that back on the person. So we didn't pay those bills, so we didn't lose out. Another one for refugee services was also a subrecipient who had overcharged the department. So we recouped the $27,000 for employees that were not, we were paying for employees who were no longer there. Next slide, please. So just based on some of those things, with the 8 staff that we had requested for internal audit, this is what the future holds for us. Just looking at the community action agencies, we've done there are 19 community action agencies. We've done 4 of them on investigations. We really want to be proactive and mitigate some of this, but because of the number of programs that we have, by having these additional staff along with the current ones that we have right now, we can divide up into teams. We can address more of these programs in which the funds are going out the door through our subrecipients, and we're not aware of it. We still currently have, I have 2 more investigations that are pending currently, another community action agency and another service provider that we haven't started yet. We're working on them, but we haven't gone out to review them yet. So between having these extra staff that we had requested will allow us to definitely delve deeper into regional accounting. And not necessarily just for regional accounting purposes, but for the counties as well, because the counties are sending the information over to regional accounting to pay. And so the counties need to be held accountable as well if there are things that they are processing or sending over to pay that shouldn't be paid, along with the subrecipients. So, we have thousands of contracts, we have thousands of programs. And if we just use community action agencies as an example, for the LIHEAP program, those funds are advanced. So there are millions that are advanced to them that we just need to make sure that they're spending them accordingly and the way that they should. Next slide. So basically, that's it for internal audit. There is a difference between, fraud and the mismanagement of funds. And fraud for us is if we can trace it to going into someone's pocket, then that is fraud. And that right there will equate to us sending it, letting the Inspector General see it, going to executive leadership and, Office of General Counsel if necessary, to see if there are charges that need to occur. But for the most part, that what we have found, it has been really mismanagement of funds for that. These are the various policies that we use and the criteria areas that we use to do our audits, along with other criteria as it comes up depending on the audit. Next slide. And that was it. Are there any questions or anything I can answer for you?
Wow. Do we have any questions? Well, we most certainly appreciate you for all this info. I think some of us need to digest a little bit. And may contact you to find out, to dive deeper if at a later date.
Yes, ma'am.
Thank you so much for your report, Ms. Wanda.
Thank you very much for having me. I appreciate it.
You're welcome.
Chair Fletcher.
Yes.
Chair Fletcher. It's Jackie. I just want to make sure that everyone, including our presenters, are aware of the schedule allowed for the meeting, because we certainly don't want to hold up any of our members longer than we had anticipated. We are at 3 o'clock now, a little beyond 3 o'clock. We've got a couple more presentations. So for my staff, if you could try to, limit the comments during your presentations to what we need to know. But of course, we would allow questions from our board members. But if we could just be conscientious of the time so that we will be able to dismiss as close to 4 o'clock as possible. Okay?
Okay. Thank you so much.
Thank you.
We will move on to our proposed rules update by Ms. Dana Carroll.
Good afternoon. Thank you very much for having us here today. I am here to, let me pull up my notes here too. Okay. Here to present the second part of a rule proposal that began at the last board meeting in August to discuss the proposed DHS rule regarding respite care for children in the custody of DFAC. Next slide. So today we will briefly review the rule change procedures, the proposed rule changes, and discuss the public comment period. We'll also discuss the final approval of the rule and then make that request to the board regarding the final rule. Next slide. At the last board meeting in August, the board voted to DHS to publish the proposed rule regarding respite care for children in DFAC's custody for public comment. And following the August meeting, we entered into a 30-day public comment period that ran from August 28th to September 27th. We also held a public hearing on September 18th at 47 Trinity. Today, we're going to request a motion for final adoption of the proposed rule by the board. And if that motion is passed, then we will submit that final rule to the Secretary of State. And that rule will then go into effect 20 days after that submission to the Secretary of State's office. Next slide. Oh, I'm sorry.
Go ahead. I was going to move to approve.
Oh, okay.
No, we move to approve these rule changes and when we actually call our official meeting to order. And we have not done that yet.
Okay.
So,
and may I ask who made that motion? Because this is at the discretion of the Department of Human Services Governing Board.
Region 6, Nancy White.
Okay, Ms. White, again, the rules are promulgated by the Department of Human Services Governing Board. So you wouldn't be the correct party to make that motion.
Understood.
Okay.
Mhm.
All right. Next slide, please. So just as a reminder, this is the proposed rule that we're discussing, 290-2-31 for respite care greater than 72 hours. This rule is needed, as we mentioned last time, to provide guidance regarding respite care of children in DFCS custody when the caregiver needs respite for more than 72 hours. The rule provides a process for caregivers to give notice of their intent to utilize respite care for more than 72 hours to DFCS, and provides a process for the appropriate screening of those caregivers. It also provides definitions for use in the rule, the intended application of the rule, and the procedure for requesting respite for more than 72 hours. Next slide, please. So as I mentioned previously, the proposed rule was published for public comments from August 28th through September 27th. The only comment that was received concerned concerns about the current system not being ideal for foster parents who need respite for more than 72 hours. The commenter, however, believed that foster families should be entrusted to make decisions about who is qualified to care for children in their home, or that CPA should be allowed to perform those evaluations. As was provided to you, the DHS response to those comments addressed the need for a clear process to assess the safety of children in custody of the state for any home in which they would be spending more than 72 consecutive hours. We also clarified that the foster parent is still choosing the caregiver, but that DFCS is ultimately responsible for approving those caregivers and for extended respite of more than 72 hours. Additionally, a public hearing was held on September 18th. We had one attendee at that hearing, and that individual just made a brief statement at the hearing that he was in favor of the proposed rule and believed that it would provide some necessary clarity and flexibility for foster parents seeking extended respite care for children in DFCS custody. Next slide, please. So at this time, we would just ask that the board consider a motion for the final adoption of Rule 290-2-31 regarding the respite care for children in DFCS custody for more than 72 hours. Next slide. Thank you very much. And that's all I have. I'm happy to entertain any questions.
Thank you. I think we understand, and we'll entertain that motion in just a few minutes.
Thank you.
We will now have our CPA rule change by Ms. Pamela Carr-Cosby and Christopher Henry.
Okay. Good afternoon, Chair Fletcher, members of the board. I'm Pamela Carr-Cosby, Deputy General Counsel here with DHS. Excited to be talking to you just very briefly about our proposed rule changes to our CPA rules. Here with me is Christopher Henry, who's the Associate General Counsel assigned to our Office of Inspector General, Residential Child Care Licensing Unit. Chris will briefly walk you through just a few of the highlights of the rule revisions, especially since you already have a 7-page synopsis of the rule changes, as well as a marked up version that includes 73 pages of the rule revisions. So, also present is Beth Vineyard. Beth is the Director of the Residential Child Care Licensing Program, and she's here just in case there are some specific programmatic matters that you have some questions about. Next slide, please. Okay. From your board package, you can see that the rule changes are extensive. I can tell you that RCCL worked many months to include providers, DFCS staff, leadership, and just to provide input to these rules. RCCL actually reached out even before beginning to draft the rules to licensed child placing agencies for any input that they may have, and after they participated, child placing agencies participated in work groups to review proposed revisions. So RCCL received some very positive feedback. So we're very proud of this collaborative effort to streamline the regulations, make them less burdensome, where it was safe to do so in that sense. Okay. Next slide, please. Okay, now I won't go over the rule change procedures. They pretty much are the same as what Dana indicated before, but we're at just the very initial stage of this process where we are going to be asking the board to consider a motion to publish the rules. Next slide. All right, well, Chris will just point out just a few highlights regarding the revisions, just a few. All right, Chris.
Good afternoon, Madam Chair, members of the board, and Commissioner Gross. I'm going to start off with added the definition of a reasonable and prudent parenting. That stems from us reviewing the Preventing Sex Trafficking and Strengthening Families Act of 2014, which was issued by Congress. And the purpose of that legislation was Congress was attempting to create some normalcy in foster children. So that was the basis of that. I'm going to skip down to the last one, remove the provision that persons or entities have to consult with DHS before establishing a CPA. And a CPA is a child placing agency. And the reason was we just saw that as being an extra burden on providers. So we felt that we had the right to just remove it. Next slide, please. I'm going to go to the bottom. Referenced applicable Georgia Code sections related to criminal records checks provisions. And currently in the rules, what we have is that we have all of the covered crimes listed out. What we're proposing to do is that we would delete those covered crimes and just reference the applicable Georgia Code sections that relate to the criminal records check provisions on directors, owners, and employees. Currently, foster parents, we do just reference the applicable Georgia Code. So we would just be doing it on the basis of consistency with what we've previously done. Next slide, please. Next slide, please. Next slide, please. The second one clarified that no foster child may co-sleep or bed share with an adult, and no foster child over 24 months may sleep in the room with an adult. Presently, the rule is that no child shall share a room with an adult. And as a result of that rule, what has happened between 2022 and 2023 is that we've received 13 waiver requests for the rule. And we feel that we can reduce that number if we up the age from 1 year to over 24 months. We also think that, we were also concerned about the safety of the children and the adult. So for the purpose of, we followed the industry standard for safe sleep, and we requested that there be no co-sleeping or bed sharing with an adult and a foster child. Next slide, please. The last one, rule updated to notify applicants that they must attend training conducted by RCCL prior to submitting an application for an initial license. And presently, RCCL has applicants attend a mandatory applications training, and that's short form for MAT. And the only thing is that they haven't written that down formally, so we're now writing that down formally. But basically, when they attend this meeting, they learn the do's and don'ts of the application process, and it's very helpful and very useful to the providers. Next slide, please. Next slide. Next slide. CPA will no longer be the last one. CPA will no longer be required to provide a copy of the disaster preparedness plan to the local EMA and include the local EMA, and development of the plan will be removed. EMA is Emergency Management Agency, and what it is that providers are required to provide them with a copy of the disaster preparedness plan. What we found when we contacted the local EMA is that all they do is just take a copy of it and file it away. They have no use for it. So it's a burden, it's just extra burden that's being placed on providers. So we're just looking to remove that burden. Next slide, please. And I'll turn it back over to Pamela.
All right, thanks so much, Chris and Beth. During the public comment period, we expected to go from tomorrow, which is November 30th, through December 30th, and to hold a public hearing on December 15th. if the motion is approved by the board. Next slide, please. Next slide. Any questions?
I think we understand, and we understand what we need to do.
Thank you.
Thank you so much. Appreciate your time. Now we will have our Commissioner Boyce will present her report.
Chair Fletcher and Chair Dorsey Mott, this is Emma McCullough. The commissioner apologizes, but she's actually dealing with an emergency right now, so she will be unable to give a report this afternoon. If any of our board members have questions that they want directed towards the commissioner, please feel free to email me. I just dropped my email in the chat and we'll get that back to you guys.
Okay, thank you so much. We appreciate that. We are scheduled at this time to do a break. I don't know if any board member, I think we probably have, since we are doing virtually, that we're probably okay, and we will skip the break and we will go ahead and officially call the November 29th board meeting to order, so that we can conduct the official business that we need to by us and also DFCS board. The first action item that let me say this. We want to ask you to please, as always, state your name when making the motion or a second, so that it can be included in the minutes and people won't have they won't wonder who did what. So in August of 23rd, the minutes were distributed to you electronically. And I'm asking, are there any correction to those minutes? Hearing none, do I hear a motion?
Madam Chair, this is Dave Barbie. I move that we approve the minutes of the meeting on August the 23rd.
All right. Do I hear a second?
Madam Chair, Nancy with Region 6 gives a second to the motion.
She can't do that.
I'm sorry,
I'm
Nancy.
DHS. Okay.
DHS board member must give that.
I heard you say that, and I keep on confusing DHS.
Okay, your moment is coming up in a minute when your chairman will be asking you to approve certain motions. But do I hear a second from the DHS board member? No.
Madam Chair, this is
Madam-
Wes Lewis. I second the motion.
Who did that?
Wes Lewis.
Thank you. Thank you. All right. It has been moved and properly second that the Board of Human Services minutes for August the 23rd, 23 meeting be approved. Is there any further discussion? We'll now take a vote. All those in favor, you can say aye.
Aye.
Okay. Those that are not, let me hear any nays. Okay, the minutes are approved. September the 7th, 23, we had a special meeting and the minutes have been distributed to you. Are there any correction to these minutes? May I have a motion?
Madam Chair, Dave Barbie, I make a motion that we approve the minutes of the special call meeting of September 7th.
Okay, do I hear a second?
Madam Chair, Wes Lewis, I second the motion.
Okay, it has been moved and properly second that the Board of Human Services minutes for September the 7th, 23 meeting be approved. Is there any further discussion? All in favor, say aye.
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 I'm particularly interested if there are any nays. Okay, the minutes are approved. The board will now consider the proposed rule change for the Division of Family and Children's Services related to respite care of more than 72 hours for children in foster care. Is there a motion?
Madam Chair, David Barbie, I move that the proposed new rule 290-2-31, 290-2-3101 through 290-2-31-03 of the rules of the Department of Human Services entitled Rules and Regulations for Respite Care of More Than 72 Hours for Children in Foster Care, as presented to the public by notice dated August the 28th, 2023, be approved and adopted, certified by the Commissioner, and filed with the Secretary of State as provided by law, with an effective date of December 20th, 2023.
Do I hear a second?
Madam Chair, Wes Lewis, second.
Okay, it has been moved and properly second that the proposed rule changes from the Division of Family and Children's Services be approved and adopted. Is there any further discussion? We will now take a vote. All in favor, say aye.
Aye.
All not in favor, say nay. The rule is approved. The rule change. The board will now consider the proposed rule changes for residential child care and licensing related to child placing agencies. Is there a motion?
Madam Chair, is this the motion for the publish?
Yes, residential child care, yes.
Madam Chair, Dave Barbie, I move that the proposed amendment to Rule Chapter 290-9-2, Rules of 290-9-2-01 through 290-9-2-15 of the Rules of the Department of Human Services entitled Rules and Regulations for Child Placement Agencies be published for a 30-day public comment period.
May I get a second?
Madam Chair, Wes Lewis, I second that motion.
All right. It has been moved and properly second that the proposed rule changes from residential child care licensing be approved for publishing for a 30-day public comment period. Is there any further discussion? All in favor, say aye.
Aye.
All opposed, say nay. Okay, it is adopted that we have the publishing period for 30 days. So we will now turn the house over to our chair, Beva Dorsey Mott, to conduct the DFCS Advisory Board business.
Thank you, Madam Fletcher. So we do have a quorum now, and we will go back and approve the agenda for today. And we ask that you state your name when making a motion or a second. Are there any questions or corrections or adjustments that are needed for the agenda? Okay. Hearing none, I will entertain a motion to approve the agenda for today's meeting.
Jennifer Shimpo, member at large. I vote to approve the agenda.
Thank you. Is there a second?
Second by Nancy White, Region 6.
Thank you. Any discussion? All those in favor of approving the agenda for today's meeting, please say aye.
Aye.
Aye. Aye.
Any opposed? Please use the sign nay, please. Okay, the agenda for today's meeting has been approved. The August 30th, 2023 meeting minutes have been distributed to you. Are there any corrections that are needed? Okay. Hearing none, I will entertain a motion to approve the minutes from our August 30th meeting.
Randall Hambrick, Region 3, I move that we approve the minutes.
Thank you. Is there a second?
Shundina Morris, Region 14. I second the motion.
Thank you. It has been properly moved and seconded that the meeting minutes for August 30th be approved. Is there any discussion? All those in favor say aye.
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 Any opposed? Nay. Okay, the August 30th meeting minutes stand approved. The next item that we have on the agenda, so next slide, please. The next item that we have on the agenda is the approval for executive committee nominees. Nominee statements of qualifications for the executive committee have been distributed to the board. We will now vote on the position of secretary. And the nominees are Jennifer Shinpolk and Nancy White. Is there a motion to move forward with voting on the secretary position? May I get a motion?
Meredith Holt, Region 13. I move that we vote on secretary.
Okay, is there a second?
Randall Hambrick, Region 3. Yes.
Okay, thank you. It has been moved and properly seconded that we vote on the executive committee position of secretary. Each member shall voice their vote once your preferred candidate is named. But let's go on and close out the vote for voting on this position. So all those in favor of moving forward with the vote for the position of secretary, please say aye.
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 Aye. Aye.
Any opposed? Nay. Okay, so we will go through the votes now for the two nominees. The first nominee is Jennifer Shinpolk, and if you would like for Jennifer to serve as the secretary for the Division of Family and Children Services Advisory Board, please say aye.
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 Aye. Aye.
Aye.
Okay, so we are going to ensure that we accurately account for the votes. Please say your name so that we can ensure that the staff have the votes counted properly or accurately. So we'll start over. So all those in favor of Jennifer Shinpolk, please state your name and aye, please.
South Octavia Ferguson, aye.
Randall Hambrick, aye.
Meredith Holt, aye.
Allie Christensen, aye.
Jeff Maurer, aye.
Okay, thank you. And all those in favor of
Lacey Tippins, aye. I couldn't get unmuted.
Okay, thank you. All right, all those in favor of having Nancy White as the secretary, please say aye and your name.
Shundina Morris, aye.
Okay, thank you. I'm not sure if we've heard from everybody who's present, but if I could get some assistance from the staff to ensure that we don't have anything listed in the chat.
We do not have anything currently listed in the chat or any emails or texts to the staff, so the vote stands.
Okay. All right. So the next secretary for the Division of Family and Children Services Advisory Board will be Jennifer Shinpolk. So congratulations, Jennifer. And thank you, Nancy White, for agreeing to serve in this position or being willing to. So congratulations. Now we will move into our board member committee and regional reports. We do have a report from our regional issues committee, and so we will ask that the chairperson, Meredith Hope, give us an update.
Hi, good afternoon, everyone. Some of the things that the Regional Trends Committee has been discussing recently. We are looking for a better understanding of the bylaw we most recently approved, and so committee members know how to best support DFCS while still working in their professional positions. And so our recommendation is a training session. We've spoken with Emma and Emily, and that is completely in the works. And we've also noticed that some committees are not meeting and are not active at all. And our recommendation is to reevaluate the current committees. Emma had sent out a link via email to check people's interest in committees so that we can kind of evaluate the committees and move in a direction where people are feeling like they are proactive and involved with the advisory board. We have seen in the media information about Senator Ossoff's inquiry into Georgia DFCS. We don't have any recommendations at the time, but we would like to know how we can best assist the department at this time. And we were also hoping to get any type of update. I know DFCS sent a response to the Subcommittee on Human Rights on October 31st, 2023, and I didn't know if they had gotten a response yet from the committee. So we just want to know how we can best help and serve the department at this time.
Thank you. Are there any questions for Meredith Hope on that committee update? Okay, if not, then we will go into our regional updates. Next slide, please. We ask that members share 1 to 2 areas that are going well and 1 to 2 areas of improvement for the region. If we could limit that information to the reports, then I believe we'll be able to stay on track with the time frame for the meeting. So we'll start with Region 2. Is there an update today? Region 3.
Hey, it's Randall Hambrick. Okay, so a couple of wins. One of the things that was nice is that Paulding has brought on 2 senior community service employees to support in clerical work, and they're paid for through a federal program. So that's been helpful. And then they're also recruiting interns as well, which has been great. And then Douglas reported that they were able to approve year-end supplements for all of their employees, depending upon how long they had been there, is the amount changed. But that's really helpful. A lot of our counties are unable to, they don't have county funds to do that. So that's great for Douglas. Some of the challenges are behavioral health of kids. So we've had a lot of kids, multiple families each month that are struggling managing a child's behavioral health issues and have just really turned to DFCS, wanting to abandon the kids because it's just been really, really challenging. So that's an issue, the behavioral health of our children who have been adopted or are in foster care right now. Another thing is recruitment and retention of staff, and those counties that allow funds for incentivizing the employees or rewarding them or doing nice things, it's really helpful. Several of our counties don't allow that. So one of the things that one of our counties put in their year-end report was they would really like the state to consider staff pay rates and positions to be reevaluated and assigned according to fair market salary so our employees can work at a livable wage. So we really feel like a bump in salary could really help retain employees and get them excited about what they're doing. I guess that's it. 2 of each. Thank you.
Okay, thank you. Region 5.
Yes, Octavia Ferguson here. I'd like to report that one of our permanency directors reported that we have exceeded our adoption goal for our region. So that was some good news. And earlier today, I also heard uplifted the community care that was piloted in Region 5. I'd like to mention as well. And lastly, excuse me, I have my little ones home with me. Lastly, I would like to report that with me transitioning off the board in December, I'm still just taking the time to uplift the importance of having a person present with lived experience in foster care. And I look forward to seeing who that would be.
Thank you. Region 6.
You're on mute.
Getting foster homes for teens for complex needs, and as well as sibling groups. And of course, we are going out of state sometimes to acquire these, which is not ideal. So that would be an ongoing challenge. The successes really are some of the activities for recruiting families. There was a pickleball tournament in Milledgeville recently to recruit families, and now we're going to do the same type of event in Bibb County for that. We've also set up booths at the Mercer University homecoming game, had a family movie event at a church in Warner Robins, which is Houston County, and participated in First Fridays in both Jones and Baldwin counties.
Thank you. Region 10. Region 11.
Hi, Lacey Tippins, Region 11. I can report as of our meeting on November 9th, we had no children in a hotel, which was awesome. And one thing we're looking into is potentially using county funds to help with staff retention. Our turnover rate is pretty high in our region, and staff retention is a huge goal right now.
Okay, thank you. Region 12. Region 13.
Region 13, we've had some changes in directors. Our very own Holly Campalong, who was the Region 13 director, was promoted recently to Metro District Director, and so we're very pleased for her. I will miss her in Region 13, but I'm excited for this new opportunity for her, and they are going to post the position, and we'll be looking for a Region 13 Director in the near future. In Region 13, they just kicked off their next level leadership series, and that started in October. It consists of 16 case managers and supervisors from all 3 counties in the region. They'll meet monthly and they'll focus on leadership development and develop skills that will prepare them for promotional opportunities or just being a more effective leader, confident leader in their current role. It's a 6-month program for everyone. It's a huge commitment. Providing these types of trainings, we're hoping will help with retention and give people some skills to be promoted within DFCS itself. So we're looking forward to watching them over the next several months and hoping everyone graduates. And that's what's going on in Region 13.
Thank you. Region 14.
Good afternoon, everyone. Shandina Morris. I'm going to start with the super positive. November 17th, as a part of National Adoption Month, in DeKalb County, we had National Adoption Day, in which we had Commissioner Brose attend. We had a wonderful, wonderful event with numerous adoptions. I had the pleasure to preside over 4 adoptions myself. So a great event, great turnout with the adoptive parents, foster parents, so it was great. In terms of needs for the region, as I believe stated earlier, for Region 14, need more staff. The staff need more pay. One of the questions that was presented was, well, when people apply for these positions, they know what they pay, but when you look at the workload in comparison to the pay, there really is no matchup. And so just need to hopefully look at ways to increase the salaries and maybe overtime pay, because with the comp hours, even though they are banked, the staff do not have the opportunity to use it because of the workload. But the staff, everyone seems to still be in high spirits, and everybody is very engaged with ensuring the well-being of the children. So that is great. In terms of with the County Advisory Board, DeKalb County Advisory Board, what they have suggested is to find ways to combat the negative narrative with more positive media attention within the region, but not only within the region, possibly within the state. So if we could have a more positive outpouring of media displays, that would probably be great.
Thank you. Do we have any updates from our at-large members?
Hey, this is Jennifer Shimpo. Well, first off, I wanted to welcome Jeff Marr from Region 3, who has just joined our board, and just give him a warm welcome. He is new. And it kind of goes along with this. What I wanted to report is that back in September, I was able to be a part of TBRI practitioner training, along with Allie Christensen, who was a trainer, and Jeff and his wife, Mary Margaret, who hosted that at Restoration Rome, and helped lead over 100 people get practitioner trained in trust-based relational intervention training. And those people are now available throughout our state to offer trainings. And it's such a great program and a great way to help people understand trauma and how to help children find a place of healing through attachment-based trauma healing. The other thing I wanted to report was that I've had the opportunity to attend the Senate Study Committee meetings that have been going on, and those recommendations came out this past Monday from the committee of what they were submitting to the Lieutenant Governor's office for 2024 legislation. And it's a lot of topics that we have been discussing and talking about in the Trends Committee. But just briefly, I wanted to name some of those, and maybe at a future meeting we can talk further about those with the commissioner and see how we can support the department in the Lieutenant Governor's office, because they're important issues. Case manager retention, permanency for children, state identification cards for children in care, expanding infant toddler court system, which helps move children to permanency quicker, and then foster parent, adoptive parent retention, and then some other things dealing with a program called Handle with Care, which I know some of our board members are also associated with. It's such a great program to identify children who might have experienced some kind of trauma over the time when they're at home, and the police can notify the school system to handle those children with care following their return to school. So those are just some updates I wanted to give. Thanks.
Thank you. For the Region 8 just mention a couple of things quickly. So there were 48 adoptions finalized over the last year, and the lobbies are opened for expanded days and time to assist customers in several of the counties in Region 8. And they are in the process of hiring case managers and supervisors in 8 of the counties, which is good news, because we know that the workforce staffing has been a challenge. So thank you everyone for your regional reports and updates, and thank you Meredith for the committee update. And before I turn it back over to Madam Fletcher, I will thank all of the DFCS Advisory Board members for your participation today. I want to welcome Jeff Meyer again as a new member. And we do have 2 members who will be rolling off of the board this year. One is Judy Manning and the other one is Octavia Ferguson. So thank you so much for your service and dedication to the advisory board. And I'd like to just say happy holidays to everyone. Madam Fletcher.
Thank you so much. We appreciate your remarks. And I also, on behalf of the board, would like to wish everyone happy holidays as we approach this Christmas season. I hesitated to announce this, but I think I am going to do it since all the board members are present today. But this is my last board meeting as chairing for you with the DHS Department of Human Services. I'm tendering my resignation as chair and in my position on the board effective December the 31st. Or at the pleasure of the governor, which he will receive my letter, and I also will CC or send it to the commissioner. I have been on the board since 2005. Governor Sonny Perdue appointed me, and that was to the DHR board, and of course I was vice chairman then, coming on. And then 2009, when we reorganized, I have been chairman since 2009 to the present day. That is a total 18 years of service, and I will tell you it was an honor, a true honor, and it's sits high, in a high position in my life. It's one of the things that I loved, I cherished, I really, it's just a high point of my life. But I would like to, I enjoyed working with each and every board member that is present and those some that are in the past. It's been an honor. And with that, we're going to say happy holidays, and we're going to say that our meeting is adjourned. Thank you so much. Thank you all for coming. And we bid you farewell. Bye-bye.
Thank you.
You're welcome. Okay.
Tina, Dave Barbie, Madam Chair, I'm going to miss you, and I thank you for your service and your leadership, and you've been a tremendous asset to this board. And and I think I've been on here 7 years, but you have shown great courage and leadership of what we have been doing and the changes that we've had to go on and do as a board. And again, we're going to deeply miss you. And I wish you a very, very Merry Christmas and a very happy holidays. And I hope I see you soon. Okay.
Thank you. I appreciate it. Thank you so much. Thank you so much, Dave.
Sure.
All right.
Chair Fletcher.
Yes.
I know that the commissioner was called away unexpectedly, but I think I can speak on her behalf just to say thank you. We really appreciate what you contribute to the board, and we will miss you. So with that being the case, I have sent her an email, and she did express that she was sad to hear that.
Thank you. I really appreciate it. All right. I appreciate it. Thank you. With that being said, the meeting is adjourned.
Thank you.
Mm-hmm.
Bye-bye.
Bye-bye.
Thank you. Merry Christmas.
Merry Christmas.
Merry Christmas, everyone.
Merry Christmas.